Hi, hey, Ivy. My name's Luke. I'm gonna be your RN today. Can I get you to verify your name and date of birth? Okay, good. Today I'm just gonna be cleaning your site for your central line. Then I'm gonna be drawing up some blood draws for CBC, which is complete blood count, and the BMP, which is basic metabolic panels for your electrolytes, like sodium and magnesium and stuff like that. So I'm just gonna raise your head of the bed up real quick. You in any pain right now? No? Good. Any allergies to anything? Chlorhexidine, latex, iodine? Good. No allergies. Alright, I'm gonna put on some gloves real quick. I'm gonna assess your site, get everything ready before I get my stuff up. I'm gonna have to, before we start, when I start cleaning everything, I'm gonna have to have you wear a mask and I'm gonna wear a mask. No drainage, no exudate, no irritation, no inflammation, no redness. Looks good, clean, normal. I'm gonna put this on now because I'm gonna go get my sterile food ready. I'm gonna put one on myself. If that's all right with you. And then before we start the procedure, I'm gonna have you turn your head the other way, away from your site, okay? Just a little bit closer before I open up my sterile field. This bad boy on. Actually, I'll put this right here. Okay. Hygiene again. Let me forget. Put on my sterile gloves and get rid of your dressing. Get this stuff out of the way too. Take these, get rid of the just to come with it. Away. Throw my gloves away. Ooh. Before I forget, almost forgot another thing. I'm gonna tape that line in place by your shoulder. That way it doesn't move when I'm cleaning everything. Tape it all the way up here. Might be hard to stick to the mannequin, but as long as it doesn't completely move, keeps the pick from coming out any further. Okay. Get rid of these. Do some hand hygiene again, then I can get my sterile gloves on. Hopefully it all works out.
Well, because I put my sterile gloves on, and then I went to put my water in the bin, and I was like, my gloves are sterile, and I'm not sterile.
Get out I'm actually gonna move this out of the way. Ooh. Move this out of
Yeah,
the
I
way.
was standing in the middle of this.
Get this would be in a package, that's my chlorhexidine tip buffer. And then I get my chlorhexidine out itself. Just pop that, get over to the dressing site. 30 seconds, clean around everything, make sure I get the lines themselves, definitely around the site, and then around it. 30 seconds about, make sure everything's good. Maintaining my sterility. Okay, good. This should get thrown away. And then I'm going to take my buffer. That is going to go over the line. And make sure the line is where it's supposed to be. Good. Alright, get this. Done the sterile procedure for the most part, so I just need to put the dressing on. good. Now I don't need to be sterile anymore. I'm gonna take these off. This one looks good. I'm gonna get the rest of my stuff out so I can do your CBC. Your BMP, is that all right? Be this line. I'm gonna. I'm good. Okay. Make sure I have these ready and my flush ready. Take this tape off now. Don't need it anymore. Unclamp my line. Take off the green cap. Normally I'd have another one, but we don't have another one to use, so that would be a fresh green cap that I'm going to put on after. Clean the catheter tip for about 15 seconds to make sure that it's clean. Good. Make sure that there's no air in my do my pulsatile flush, pulsatile method as I push to flush my line. Good. And I'm going to drop my waist, so I'm going to draw up 5 to 10. We'll just do 10 to make it easy. It's about 9, but that should be fine. This is going to be my waist. I take my empty syringe from my draw. I need 3 mils for 2 different tests. So I'm going to draw up 6 mils of blood. It is almost exactly 6. Cool. That's good. I'm going to set that back over here as well. I'm going to take my last flush and my other alcohol pad. I'm going to clean this again for 15 seconds. 15 seconds went by. Take my last flush here. Make sure there's no air. Flush the line one last time. Make sure to lock it. And put on, this would be a new green cap, but this should be a fresh green cap. Make sure it's capped. Good. I'm going to get rid of all this junk real quick, and then get my buffer, and then I'm going to start with this would be my BMP green top. Oh, what am I doing? Put it on the wrong thing. Get out of here. My 6 mils of blood for my buffer, not an empty syringe. Gonna do my BMP first, and then I will do my blood draw. Each one needs 3. Make sure I can see it. 3. A little bit of negative pressure there, but it should be good. Good. And then I'll do my CBC. Good. Then I make sure I have labels printed out with my patient information on them. I put them in a biohazard bag before I sent them to the lab, but I'll put them over here as if they had those things and they're in the biohazard bag ready to go. I'm going to take my buffer and it's going to go in the sharps container. Notionally, I'm going to make sure to get the rest of my area cleaned up. This would be wasted, so I throw this away, but we're reusing it for other lab activities. And I'm going to get everything cleaned up, ready to go. Get this out of the way. Make sure the site's good. Make sure this is good. All right, Ivy, we're done. Is there anything else you need before I go? I can take that mask off of you. Actually, I put my glove on for when I do that. I'm gonna lower your bed again. There we go. Make sure patient has their call light. Make sure everything is good with them. Other than that, she doesn't need anything. We're good. I'm gonna document the wound change and then take these to lab.